let me just give you a couple of examples of what's going to happen. And Florida DEP has some difficult to understand phrases in these air permits that I don't really know what they mean. But they're sort of talking more about regional levels being high, therefore the local impact won't matter. I don't get the logic of that at all, but let me give you a couple of examples of things that we know. Nobody has done a study where they took 30 years ago a big biomass plant and sort of looked at the community effects for the next 30 years because nobody realized what the impact was going to be, and because most people didn't understand 30 years ago how toxic particulates are. So a lot of this is still sort of looking ahead. But one of the things, we've had a couple of sort of natural experiments. One was the Atlanta Olympics, in which they cut down vehicular traffic tremendously, et cetera. And the air quality in Atlanta for 3 weeks was just about as good as you could possibly get it. And when you look at what happened then with respiratory disease and cardiac disease in terms of office visits, hospital admissions, emergency room visits, they dropped by about 55%. Big, big change. And in terms of people's well-being, it's a big change. But one of the other issues, which we also have to take into account here, or we're pretty stupid if we don't take into account, is that everybody's sitting here wondering, what are we going to do with the healthcare system? The cost of this, in terms of external healthcare costs, is going to be horrendous. So, a couple of quick examples about how bad it's going to be. When I was going to medical school 35 years ago, they taught us that if you're breathing smog or whatever else, if you're an asthmatic, will make it worse. That's true. It's still true. But what we now know is because we've had children exposed to higher levels for longer periods of time, not only does it make asthma worse, but it causes asthma. From a medical point of view, in terms of statistics and pathophysiology, that is a major leap. That's not a small thing. That's a major, major, big time leap. Okay. There's a study in California where they took 2 groups of kids, healthy athletes, right along the I-5 corridor in California, where there's a lot of particulate material. Some of it's power plant related, some of it's truck related, but it doesn't matter. The point is about what's the impact of particulates. They took these 2 groups of kids. One group of kids played indoor sports. The other group of kids played 3 outdoor sports during the year. These are varsity athletes in high school, so they're pretty good shape. And then they looked at the incidence of asthma in these kids, controlled everything else. So basically, the only variable was exposure to particulates. The incidence of the asthma in the outdoor athletes after 4 years was almost 300% higher than kids who did it. I started off my career doing pediatric intensive care, and one of the things that we still don't understand entirely is what induces premature labor. For lots of reasons, something you don't want to have happen. Psychologically, it's bad news. From a medical expense point of view, it's a very, very expensive event. Well, one of the things that they've now been able to show in the last 2 or 3 years is there is no question that one of these significant precipitant factors in premature labor is exposure to high particulate levels. No doubt about it. Doesn't explain everything, but there's no doubt that that's an issue. Another study on I-5 in California has looked at the cancer risks for about 20 different cancers. And just to pick on the males a minute, one of the cancers which has the most high correlation in incidence to particulates is prostate cancer. About 280% increase in I-5 versus a similar area in California where they don't have the truck traffic. They studied about 30 cancers now, and about 23 of them have statistically significant increase in incidence along the I-5 corridor. It's correlated to the particulate exposure. This goes on and on and on. Some of the things that the proponents of this plant may show you is they'll say, well,